Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Vitamin safety, laboratory management. That is what I shall be talking about. Vitamins are generally the supplements and the natural vitamins that you take along with your food. The natural vitamins that is present in our diet are very helpful and may not really harm us. But the supplements are not regulated, and therefore one could have experiences like side effects, overdosage, and the other complications that may set in. So these problems we may not know except we experience the symptom, or we allow the laboratory, or when we complain, allow the laboratory to now do some examinations on the normal value, whether there is an overdosage of that particular supplement. But with diets, you don't have overdosage. But in any case, from the last study, we are able to know that when you take too much of anything, excess food or diet really result in you now experiencing plaque formation in the vessels, blood vessels. And also vitamin D, which is a vitamin, natural vitamin, could also have you could also experience overdosage in it, and then you have more calcium calcified and also settling in the tissues and blood vessels. So the complications are so many, and that is what I want us to look in. How the laboratory can help in the management of these abuses of the vitamins as supplements that we take regularly. The assistant of the medical laboratory service or science in this direction would also help reduce problems that has been proven. Studies have proven that beta carotene, when taken in overdosage, when it's too much, could also make the lung cancer in those smokers or people who are already high risk people to experience that cancer earlier than expected. The same thing for the colon. There are so many studies, but if we can also help ourselves with this knowledge, we can then ask for the measurements or estimations of all these vitamins supplements that we take. But as usual, more on this special talk is on the slide section, where all the vitamins that are harmful will be exposed, and also what the laboratory management is all about with vitamins. So as usual, click the like button, subscribe, and more knowledge will be exposed to you. The outline, objective, introduction, research findings, laboratory management, and conclusion are all I shall be talking about. The objective, to create more awareness on the harmful effects of supplement abuse and how the medical laboratory could be of immense assistance in the management of this condition. The introduction. From elementary study, we know about the voyagers or explorers like Christopher Columbus and co., whose crew members died mysteriously of scurvy after being fed well in the voyage. After thorough research, it was discovered that the condition resulted from a lack of vitamin C. Avitaminosis was discovered to be the cause of many other conditions like rickety, night blindness, pernicious anemia, and many more, which I shall also try to touch in this study, in this video enlightenment. In order to correct avitaminosis, supplements of various vitamins were synthesized and added to food products to cancel diseases. As expected, from the sources recorded, people started abusing vitamins, resulting in various symptoms as known. Vitamins deficiency is known as avitaminosis, and it presents as conditions that are prevented or treated by dietary changes of increasing intake of vitamins-rich food. However, vitamin safety becomes an issue when the vitamin intake is inadequate, necessitating to raise their levels, especially in cases of malabsorption that usually have underlying medical conditions contributing to it. Laboratory management will help in optimal control of being not too much of vitamins nor little of it, like it is done in bacterial endocarditis to forestall toxicity to the kidney and other organs of the body. Because when that anti biogram or the sensitivity study is done, it's always something that maintains the MIC at a level that will not cause damage to other organs. Some vitamins are even antagonistic to certain substances used in their estimation. So questions are asked the patient before embarking on testing in the lab. Research findings. Beta carotene, that is the provitamin A, once you have high dose of this supplement, can increase the risk of lung cancer in current and former smokers. Vitamin E, on the other hand, can increase, once it's on the high side, the risk of prostate cancer development and mortality. The same thing with vitamin B6, once it's on the high side, overdosage of it, and B12. Long-term high dose supplementation has been associated with an increased risk of lung cancers. Vitamin B9 supplementation has been linked to an increased risk of colon cancers. Selenium long-term use supplementation has been associated with increased prostate cancer mortality. The same thing with zinc supplementation is linked to an increased risk of aggressive prostate cancer and mortality. Copper and iron, high level of these minerals in serum, have been associated with an increased risk for certain cancers in observational studies. And these are just a case of vitamins and minerals that's high dosage, because they are more or less used as supplement. The body is supposed to take them from food, but when they are inadequate at times, you want to supplement it. Yes, safety is our primary concern. You can also think about the interaction. Supplements can interact with other medications or have effect on the body that are not immediately apparent, thereby making bioavailability an issue, as well as the detrimental effect of the interaction, which we don't know what it might have caused. Vitamin E, on the other hand, is the natural form consists of a single isomer, while the synthetic form is a mixture of 8 different isomers. The natural form is absorbed about twice as efficiently by the body. So you can look at that as, when it's in the natural form, the body needs very little, whereas the artificial or synthetic becomes something you use high amount, and which could be also an issue when you talk about safety. Vitamin C bioavailability. Vitamin C is an orange, is accompanied by bioflavonoids, which can aid its absorption and retention. That tells you that even with vitamin C, the supplements may not easily be absorbed, but when it's in the natural form, it comes with bioflavonoid that would help it. Production process is also another issue. Natural supplements are derived from food or plant sources, while synthetic supplements are mass-produced in a lab using chemical processes, which can sometimes involve petroleum extract or quota derivatives. So the choice is yours when you're talking of natural and synthetic vitamins. Impurity and additive are also other issues that must be put into consideration so that we know what our choices are. The laboratory management. Yeah, majority of the tests that we do, samples collections are usually blood and urine, because these vitamins could be excreted through that means too. The values you will be looking for, that is the normal values, is as listed there. Vitamin A would, for 1 to 6 years, you can see very low level from 2.4 to 40 microgram per deciliter. Adult is 30 to 80 microgram per deciliter. Vitamin E, on the other hand, is even lower quantity in nanograms. For neonates and for adults, it's also very low quantity. Vitamin K is similar to the vitamin E, vitamin B12 as well. According to WHO, the acceptable value for B12 is 201 nanogram per liter, whereas anything lower than 150 nanogram per liter is a case of deficiency. Vitamin D is also shown. Common lab tests we could do are listed, so all that should help in investigation. Finally, conclusion. Generally speaking, when vitamins are consumed in food form, they are safe, but excessive intake can lead to toxicity that we must take note of, that I had earlier exposed. Also, natural vitamins from food are less likely to cause interactions with other substances in the body, but can still affect medication efficacy. It is known that taking an excessive amount of vitamin D for months can lead to hypercalcemia, just like I had exposed in the slide, kidney stone formation, which can affect kidney, cause kidney failure and even death, apart from the coronary artery calcium. With the knowledge acquired so far, once you are suspicious that your vitamins intake cause you discomfort or lethargy or whatever, it is better to visit the medical laboratory, although you can complain to your doctor first. If it's not satisfactory, visit the lab, and certain parameters, certain variables will be done, and where is a case of vitamin suspicion, the tests are specified. So if you like my presentation, just click the like button, subscribe, and more information will come your way.